everyone. All right, so the COVID-19 pandemic continues. When you follow the news, CNN, BBC, you are being told that the number of cases are surging in Europe. Closer home, in the Eastern Caribbean, there are a number of our sister islands experiencing COVID-19 outbreaks as we speak. Here in the Federation of St. Kitts and Nevis, we have just contained our third wave of COVID-19 infections. And so over this past week, Wednesday the 17th to Tuesday the 23rd of November, we've only identified 18 newly diagnosed cases of COVID-19. We've had one hospital admission during this period, one case discharged, 45 recoveries, and we've only added one COVID-related death during this past week. Now, this provides a summary of the COVID-19 status. So to date, the Federation reported 2,774 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate, with 2,716 cases being fully recovered. We are only monitoring 30 active cases. I'm so happy, only 30 active cases, 12 being monitored in Nevis, St. Kitts 18. This is the lowest number since June of this year. So we are happy. Our numbers, the number of active cases is reducing, going down, going in the right direction. And we want to keep it like that until at least next year, early next year. Now, in terms of hospitalizations, we only have one individual admitted at the Alexandra Hospital in Nevis. And as I said before, we have reported 28 COVID-19 related deaths. Now, when you look at the data, the demographic data pertaining to the COVID-19 deaths, we realized that 24 of these 28 individuals were unvaccinated, 19 were 60 years and over, 7 were within the age group 40 to 59 years. And so I want to pause and reach out to those older adults in our population. So if you are over 50 years in St. Kitts, and if you are still unvaccinated, and if perchance you have been diagnosed with any of the chronic non-communicable diseases like diabetes, hypertension, heart disease, you are vulnerable. And so you are at risk of contracting COVID. You are at risk of even getting severe COVID. So we want to pause and reach out to those older persons. If you are not yet vaccinated, go to your primary care provider, go to the nurse in your community and ask whatever questions you want. Empower yourself with the information about the vaccines. You have two options, and make a decision and come on board in terms of accepting the COVID-19 vaccine. In terms of the cases, we've looked at the 2,774 cases, and we note that 70% of these individuals were not vaccinated. 8.1% only partially vaccinated, meaning one dose on board, and 22% were fully vaccinated. So again, if you are unvaccinated, you are vulnerable. And even more so now, as we are opening up even more fully in terms of allowing individuals, or soon allowing individuals in, fully vaccinated individuals into the country, maybe without testing. And the tourists, the tourist ships, the cruise ships are here already. And so if you are unvaccinated, you are vulnerable. We launched our COVID-19 vaccination program in February of this year, and it's now 9 months. And so in 9 months, we've done well in terms of achieving these excellent coverage rates. 79.7% of our adults have received the first dose. 73.3% are fully vaccinated. In terms of the children, I think it was September, we started offering the Pfizer-BioNTech vaccine to our children 12 to 17 years, and to date 13.6% of the children within this age band have come and accepted the first dose of the Pfizer-BioNTech vaccine, and 11.3% of the children within this age band are now fully vaccinated. And so we want to reach out to the parents and guardians of our teenagers in our secondary schools. We want to focus on you over the next 2 to 3 weeks before the Christmas break in terms of giving you an opportunity to come in groups, big groups, like, classes, to come into the health center to receive the vaccine. And so we want the parents and guardians to be informed, empowered, and provide consent for your teenager to come on board and accept the vaccine. Now, this shows the data disaggregated. So yes, 79.7% of the adults in our federation have received the first dose, but then you realize it's broken down by island. 84.2% of adults in St. Kitts have received the first dose. 67.9% of the adults in Nevis have received the first dose. And so we want to reach out to the adults and the children, 12 to 17 years, both islands, to come on board. Because again, if you are unvaccinated, you're vulnerable. 52.4% of our total population is fully vaccinated. So we've done well, but we still have work to do in terms of our vaccination drive. Because when you look at, the latest information and the projections for 2022, those territories that are enjoying high vaccination coverage rates, the outlook for such territories is brighter versus those territories with a low vaccination coverage rates. The booster shot. And so the US FDA recently granted approval for individuals in the United States of America to come forward if you're 18 years and over, and if you've received your primary vaccination series, you can come forward and receive your Pfizer shot, your Pfizer booster shot. And so this is the same within the Federation. And so I want to share with you this afternoon that if you received your AstraZeneca Oxford vaccine in February, March, earlier up in this year, and 6 months would have elapsed between the second dose and present, you are eligible. Once you're 18 years and over, you are eligible to come to any of the health centers and request your Pfizer booster shot. So it is available here in the Federation. This afternoon, in the Edu Corner, I wanted to just focus on preventive health care. Now, during 2020 and earlier this year, we have been impacted adversely by the COVID-19 pandemic with a series of strict lockdowns and other restrictions. And so individuals postpone their annual medical checkups and their appointments for cancer screening. So this afternoon, what I want to highlight is the fact that cancer doesn't take a break. So yes, the COVID-19 virus is in circulation and it's impacting us adversely, but cancer doesn't take a break. And so we need to be serious about our cancer screening. So those of us who postpone our annual medical checkup last year, 2020, and even this year, 2021. Please, it's what? It's Thanksgiving, yes, but I want you to make that appointment to get your medical checkup before the end of this year. If you have not yet done your cancer screening checks for 2021, please make your appointment with your regular physician and have your cancer screening checks done. And so the danger of delayed screening is greatest for persons with known risk factors for cancer. So if you're a female and if you have a strong family history of breast cancer, so for example, if your mom or your sister or your aunt had breast cancer, you have significant risk of developing breast cancer. And so you cannot afford to delay or postpone your annual breast checkup in terms of your mammogram. If you are a male and you have a strong family history of prostate cancer, so if your dad, your brother, your uncle had prostate cancer, you cannot afford to postpone your prostate check, your direct rectal examination, or your PSA test. If you have a strong family history of colon cancer, you cannot afford to postpone your colonoscopy. And so what we are noting in different countries, there is a surge in an increase in the number of individuals showing up with different stages of cancer. And it's as a result of their postponing their annual medical checks and their cancer screening consultations. And so we want you to be aware of this, be cognizant of this, and make sure to schedule your annual medical check before the end of December 2021. So the women, make sure you go and get your breast examination, your mammogram. The males, go and get your direct rectal exam, your PSA tests. Those of you 50 and over, if you have not yet done your colonoscopy, go and have a discussion with your primary care provider. And the females, I want to remind you this afternoon about your cervical cancer screening. So this afternoon, these are just reminders. Let me repeat. If you have postponed your annual medical check and your cancer screening consultations for 2020 and 2021, do not allow this year to end before you go and have those consultations. There is also the non-communicable diseases, diabetes, hypertension. So those of you who are at risk for the NCDs, the non-communicable diseases, diabetes, hypertension, we also want you to go to your physician for your regular annual medical check. So if you are obese, overweight, if you have a family history of diabetes, hypertension, if your lifestyle is sedentary and you're not exercising, and if you are a smoker or you consume excess amount of alcohol, we want you to go and get your annual medical check and be screened for the NCDs, diabetes, and hypertension. And of course, the COVID-19 protective measures. Come on board, accept the vaccine if you've not already done so. Last night, I, reminded, the general population about the value of wearing the face mask and maintaining adequate hand hygiene. And if perchance you are not feeling well, you need to stay home. Thank you.